Hello and welcome to Monmouth in Focus, a program about the services and functions of Monmouth County government. I'm Cynthia Scott, your host for this segment of Monmouth in Focus. Well, spring has sprung, which means residents will be getting outside more often this summer. Unfortunately, the warm weather will bring an influx of unwanted pests to Monmouth County, including pesky ticks. Today, we are joined by Monmouth County Freeholder Sue Kiley, the liaison to the Monmouth County Mosquito Commission, and Dr. Andrea Agizi, a research scientist in the Tick-Borne Disease Laboratory, to discuss ticks in Monmouth County. Unfortunately, it's that time of year. We always have to bring the subject up and hopefully come closer and closer to, I don't know if I can say eradicating this issue, but really, decreasing the risk of tick-borne illnesses. Yeah. Let's start talking first about, what Monmouth County does when it comes to, like I said, decreasing the risk.
So the most important thing that we do at the county in the department and the Mosquito Commission is educate. Mm-hmm. Making sure that our residents understand the information about the tick-borne diseases. And we don't just educate the residents, we're educating the healthcare providers.
Sure.
So that they know what to look for and how to react to ticks.
Sure. And specifically, how do you educate the public when it comes to what ticks they need to look out for? I mean, we all see a tick on our animal or even somewhere in the house, and you wonder, okay, is this the dangerous one or is this okay?
Right, right. We're very, very fortunate to have Dr. Agizi and her colleague working with us in Monmouth County. They are nationally renowned for their study of ticks and tick-borne diseases. So we have a lot of information, we have a lot of brochures that we can give to the residents, help them understand what to do if they find ticks, how to avoid tick bites, etc. And just make sure that we're as well protected as we can possibly be.
Sure, absolutely, very important. And Dr. Agizi, let's talk a little bit about your research.
So the study summarizes the results of our passive tick surveillance program, which is a free tick identification service that we've offered to residents since 2006. Residents can bring in a tick that they find, and they complete a short form, and we collect information on the tick encounter, such as the residents' age and gender, what they were doing when they found the tick, where they most likely found the tick, and then we identify it to the tick species, life stage, and engorgement level. And all this gives us information about the likelihood of disease transmission. For example, the engorgement level is an indicator of how long a tick has been attached. And the longer a tick is attached, the greater the risk for disease to have been transmitted.
Right.
So residents get this information in a report that they can bring to their doctor.
Oh, that's good. So what are the species that we're looking for in Monmouth County, the dangerous ones?
There are 4 ticks that we're going to see in Monmouth County. One is a black-legged tick or a deer tick. This is the one that I worry the most about because my kids play in the backyard and we have deer that travel through the back of the yard, so we've got to check them every day. Then there's the American dog tick, or known as the wood tick. The Asian longhorn tick, which is a newer tick that has been discovered that we're seeing in Monmouth County. Lone Star tick, which is also
from
in
Texas.
Monmouth County. The Lone Star tick has arrived in Monmouth County.
Yeah. Oh boy.
And these can all transmit disease. The Lone Star is particularly concerning because it can be aggressive in biting and can create a lot of irritation if you get bit by one.
Okay. So. And we have such a tremendous deer population here in Monmouth County.
We do.
And I guess that's what we have to really look out for, the tick attaching to the deer, right? And then the tick biting the deer and then going somewhere else, correct? Is that how it works?
Or the ticks the deer can bring them into your backyard, or wherever they are. They can attach to a human, they can attach to a child, to a dog.
Sure.
And then they're coming into your home. So you really have to be careful to look for them and check the kids and check everybody if you're out in an environment where there are ticks.
And that's our next step. What do we do to protect ourselves from ticks during the summer season?
I think, one of the best things you can do is make sure that you're checking yourself and anyone that's out in an area that may have ticks in it when you come into the house. There are lots of diseases that they carry. Do you want to talk about some of those?
Sure. The black-legged or deer tick that you mentioned, that's the disease, that's the tick that transmits Lyme disease. It also transmits the agents that cause anaplasmosis and babesiosis.
Ooh, what are those? Those don't sound good.
There's a lot of osises.
Yeah,
The
yeah.
Lone Star transmits ehrlichiosis,
boy.
and the American dog tick transmits spotted fever rickettsiosis. So, fortunately, all of these diseases have similar symptoms. So, if you develop fever, headache, rash, muscle ache, joint pain, tiredness, dizziness after a tick bite, it's really important to see your doctor.
Right, immediately.
Yeah.
Yeah. And then, again, just common sense approach. Obviously, you know, I know it's hot, but wear, you know, clothes that, long sleeve clothes, try to cover up as much as you possibly can. Don't go in the wooded areas. Make sure your kids are not playing somewhere in the wood. But again, like you mentioned, it could happen in our backyards as well.
Exactly, but you're absolutely right. Light clothing is good because you'll be able to identify or see a tick more easily. There's actually clothing, and doctor taught me this, that you can buy that has the preventative or the repellent in it. So if
Wow.
you're a camper or a hiker, you can actually buy clothing that has those repellents in it to avoid having a tick on you. And then there's DEET sprays and other things like that that you can do.
Yeah, and if you are bit by a tick or you find the tick on your animal, it's very important to keep that tick, correct?
Correct, correct. And you can, well, the way you remove it is with a tweezer, get as close to the skin as you possibly can and pull it straight off. And
Okay.
even if there's a piece that stays in the skin, that's okay as long as you get most of it. I also learned that you don't want to squeeze it too tightly because you don't want it to release a pathogen into your body. And then into a Ziploc bag to the county, and we'll be able to tell you what it is and all the information that Doctor gave you earlier.
Okay, great. Is there anything else that you'd like to add, Dr. Giese, to let the public know when it comes to protecting yourself from ticks or the species of our ticks?
Well, one of the things we learned from our study is that most of the encounters that residents were having with ticks were actually happening in their backyards. And this is important because people may not remember to protect themselves if they're just stepping out in
Sure.
their backyard.
Yeah.
And even if you only go out for a short period of time, you can still be exposed to ticks. So there are some things you can do to reduce the tick population in your yard. For example, clearing leaves and brush, and keeping your lawn mowed short, because ticks thrive in moist soil conditions. So you want to make sure the sunlight is reaching your lawn and drying it out. And also, it might be a good idea to institute daily tick checks as a matter of course during the warmer months when your family comes in from playing in the yard. Just include that in your normal bathing routine so
Sure.
it becomes something that you do every day. The sooner
Absolutely.
you find a tick, then the sooner you can remove it and prevent the disease transmission.
Absolutely, yeah, and we're all hoping for a healthy tick-free season here.
That's right, that's right. I had one granddaughter come in from playing in the backyard with a tick. And we took it off immediately, but boy, it was a great lesson for the rest of her cousins.
Yeah,
Because
absolutely.
now they check every day.
Yeah, they
to
were
make
probably
sure.
That's great.
pretty
Yeah.
scared when they saw that tick on
They
her.
were, they were.
And they don't want it to be removed either because they're probably afraid it hurts.
That's right.
So yeah, yeah. So
That's right.
so really good information here. I appreciate you both joining us today here on Monmouth in Focus, and thanks so much for all of your hard work when it comes to protecting yourself from ticks and promoting awareness of the situation.
Thank you.
All right.
Good to be here.
And that is all the time we have for this segment of Monmouth in Focus. Of course, for more information, please visit www.visitmonmouth.com. I'm Cynthia Scott. Have a great day, everyone.